presentation, and she has really made a lot of effort, and thank you all for the encouragement. And thank you, Dr. Jha, for conducting this clinical meeting and taking up this with a renewed enthusiasm, this clinical meeting, and Dr. Shamanturai also. And today actually we presented this case because I was discussing with Dr. Malik and Dr. Sethi regarding this case initially when they used to come to my ward, that this patient is not improving and he had done the TSH level and it has come so low. Then they had asked me to do the free, because it is not done. In fact, even now, I don't know where Mama is here, we are not even getting the T3 and T4 levels done. So it becomes really difficult just with the TSH level to actually treat a patient. So I got it done. Since this was a non-railway patient, I was lucky that I could have get the free T3 and T4 level done from outside. And then we came to a conclusion that this will be just a physiological change in pregnancy and there is no need to treat this patient and we can just wait and watch. So that's how it triggered, and I felt like we should discuss thyroid disorders in pregnancy because there are so many aberrations in the physiological changes and the blood biochemistry itself. We should understand what is happening in the first trimester, as we have seen. So we must try to appreciate that and then we can treat the patients accordingly. That's why we have undertaken, because we will not get very overt cases of hypothyroidism. They will not get pregnant, first of all. So we will get these subclinical cases of hypo and hyperthyroidism which we have to pick up. That is very important. And the guidelines which she has presented, like when we should follow up these patients, how often. Patients are really confused because nowadays doctors give them a pregnancy profile, you do all the testing, TSH, etc., and they immediately start eltroxin or thyroid supplementation just by seeing a raised TSH level. So that doesn't make any sense, because in the first trimester, as you can see, there's a lot of aberration. So we have to follow up, at least do 2 tests, take a proper history. So these are very important to really come to a diagnosis. And secondly, whether Dr. Sethi and Dr. Malik can actually highlight that whether we should go for a universal screening of newborns. Because newborn, we do not actually know whether they are being born hypothyroid, and because in early neonatal period their main development, neurological development takes place. So whether they are becoming neurodeficit because of the subclinical hypothyroidism, whether newborn screening of the umbilical cord blood sampling should be done for TSH level, because that has been started in certain centers. So these are certain things which I would like to just talk about.
Dr. Malik, to throw some light here. Udhar.